here with Dr. Harry Leiter, who is the Chief Medical Officer for the nation's largest drugstore chain, Walgreens, based back in Chicago. And I just think it's Walgreens people now know as a healthcare company. I mean, it used to be retail and getting your prescriptions filled, and how they have nurse practitioners in the store treating people for their routine maladies and physicals, pharmacists administering vaccines. Right. But you're here to tell us at the Forbes Healthcare Summit about yet another area that Walgreens is going into that doesn't necessarily have to have the patient even come into the store to get care. So if you could tell us a little bit about that.
Sure, thanks for the opportunity, Bruce. Sure. You know, what it really is all about today, I think, for consumers is convenience. So Walgreens pioneered convenience in a physical sense by having our stores, our retail stores, on some of the best corners of America. So physically, we've always been convenient where people can come in, talk to a pharmacist, now see nurse practitioners. And now we're pushing the envelope further by using technology. And there's a few different ways we're doing that. There is our Balance Rewards program where consumers can get rewarded with Walgreens loyalty points called Balance Reward points for walking or weighing themselves, or if they're a diabetic, uploading their sugars. We also launched a program with WebMD that's going to really come to fruition next year, where there's digital tools, online tools that you can use on a phone to improve your health through our partnership with WebMD. And then now we are going to be getting into the telemedicine space, where you can consult a board-certified physician from your computer, your tablet, or your phone with a company called MD Live, and that's going to be starting very soon as well. So we're extending this idea of convenience into the digital space.
And how is this going over with your customers? I mean, that's the thing about a retail pharmacy chain. I mean, you have loyal customers. Right. I mean, how are they taking to all this? And could you give us any maybe numbers? How many people are using the app and so forth? Talk to me a little bit about that.
Consumers are really taking to this, and it's not just the young folks that you would think would take to it naturally. So let me give you a statistic you'll find interesting. Every second of every day, we are refilling a prescription with our mobile application.
Really?
People can use the phone to scan the script, the barcode, send it to whichever Walgreens store they want, refill it, one prescription per day. On the Balance Rewards idea, where you can get points for walking or weighing yourself or uploading your sugars or your blood pressure, I think we've logged 22 million miles last time I checked. That was probably yesterday. Today maybe 23 million. But that many miles of people walking and recording that information with connected devices like Fitbits, and we now have our own device. So it's growing exponentially. 20,000 people a month last time I checked were connecting new devices to our Walgreens app so they can get credit for all these activities.
That's good to hear, because when you hear about the healthcare industry being so fragmented, it's just, it causes problems. Is Walgreens also, so if I'm hooked into the system, is my doctor also hooked in? I mean, you mentioned your partner with MD Live, of course, which does the telemedicine, telehealth. How is that set up? I mean, I know Walgreens is forming partnerships with traditional healthcare systems across the country. Is my doctor able to hook into this?
Well, like most of the healthcare system, this interconnectivity is a work in progress. We are certainly doing that with some of our health system partners, where the docs in certain health systems can get data directly from us, and we're expanding that, as each month goes along. But each health system has slightly different information technology. So it isn't like flipping a switch. So it is something where the last mile, as we call it, that hooks our data into the health systems and the doctors needs to be evolved over time. That said, the infrastructure to do this we've already built. All of our pharmacists at all 8,300 some stores have an electronic medical record they use to record clinical information. So we're setting up that infrastructure so that we can transmit that information, whether it's from the pharmacist or the clinic, to physicians all over the country.
And it's set up that if you are someone who's now interacted with Walgreens in a way that you couldn't used to be pharmacists didn't administer vaccines and so forth. Do they build a medical record within Walgreens system?
We do, and that's we do have a clinical electronic medical record, again, for our pharmacists, where there is a record. So, for example, we launched a immunization app built on that framework just, I think, a month ago, where if you log in and register, all the immunizations that you receive, Bruce, and your family will be populated in that app. You can see whether you're due for anything. You'll get reminders for you or your family, and you'll be alerted when when it's really time to get an immunization. So the use of this technology to connect people to the services we have in our store is exploding. The other big idea I wanted to talk about is that the pharmacists and our nurse practitioners are doing more and more. It's not just immunizations. They're doing blood pressures. In many cases, they're doing laboratory tests, simple laboratory tests. We have a strategic pilot with a company that's gotten a lot of press called Theranos, where you can do lab tests with just a finger prick. So there's a lot of innovation, but I think this digital explosion that you talked about enables us to put all this data in one place, store it for patients, and communicate it over time to the doctors.
And one of the issues always in healthcare is how is it going to get paid for?
Right.
And so I should ask, give me a little 411 on that with the insurance companies and even Medicare and Medicaid. Are people able to get coverage for a lot of these services?
Well, earlier, it's a great question. Earlier in my career, I worked for several health plans, so I'm very, very familiar with this area. It's evolving. So for example, let's take the telemedicine concept that we're going to be rolling out with MD Live. There are some insurers, and in particular one extremely large insurer that does cover it, where they believe that by doing the telemedicine visit, you're getting quality care, as do we, by the way. You're getting really high quality care, and that it's not only more convenient, but it's more cost effective than going to a doctor's office. So the insurance coverage is there for some folks. Some health plans are evaluating it and have not yet decided beyond pilots whether they're going to cover it yet. It's our belief that over time, this is pretty compelling stuff, and with the costs going up in America for healthcare, we believe telemedicine will be covered by payers eventually, more universally.
And that brings me to the point too, because you roll out a lot of, I mean, any retailer does a lot of test piloting and whatever. What are the cost savings? Can you walk me through one, interacting with the Walgreens provider remotely as opposed to in the store or elsewhere?
Well, estimates are that if a patient would go to a primary care doctor like myself, I'm an internist by background, that the total cost of a typical office visit, whether it's borne by the consumer, the patient, or by the health plan, might be about $100. Seeing a nurse practitioner in one of our clinics, the average cost might be more like $50 to $70. That's a 30 to 40% decrease. The telemedicine visits, the market price for those today, tend to be in the range of $49. So I don't know if that gives you some sense of scale.
Certainly.
It's about less than half. Less than half. That's exactly right. Now, telemedicine isn't for everything. We wouldn't be doing telemedicine to evaluate chest pain or potential heart attacks, but for simple things like colds and upper respiratory tract infections and rashes and pink eye. I mean, there's a lot of things you can do via telemedicine. Very exciting.
And so as we look to the future, other things that you can see Walgreens getting into that might not necessarily be in the store?
I think the growth of this digital coaching and support of patients like that we're doing with MD Live, not MD Live, I'm sorry, WebMD will grow, clearly. There's a whole range of tools where consumers and patients, for example, can set goals. If they're a diabetic, to eat right, to exercise, to take their medications. So that whole digital support of chronic disease will grow. I mentioned the Theranos opportunity, where this is in the stores, where consumers can come into our stores right now in Phoenix. 24 stores, it's a test, it's a pilot. Very exciting. Get an almost painless finger prick. Get your labs done in your neighborhood or right by work at Walgreens, and then get the results back very promptly within a couple days, and perhaps even see one of our nurse practitioners for follow-up. So I think the innovation is there. Other areas that are earlier innovation, we're working with partners like Johns Hopkins, where we have a strategic partnership to use some of their brilliant clinicians to come up with new products and services that we'll offer down the road. So a lot of innovation both in our stores, in our clinics, and digitally through our partners like WebMD and MD Live.
Excellent. Dr. Harry Leiter, Chief Medical Officer for Walgreens, the nation's largest pharmacy chain. They always talk about it being on all the great corners in America. Now they're going to your home and wherever you are digitally. Thanks so much for being here.
Thanks for the opportunity, Bruce.